A study published in April in Frontiers in Public Health reported that men and women are equally likely to contract the novel coronavirus. However, the researchers also reported that men are significantly more likely to suffer from severe effects of the disease. Consultant urologist Dr. Belinda Morrison-Bligent says, while the study has to be interpreted with caution, the issue of men neglecting their health in the past is now being manifested during the COVID-19 pandemic, even here in Jamaica.
Right now, I think the data from the Ministry of Health is that we have slightly more women diagnosed than men. And though we do not have that many cases that have died, thankfully, there's a slight preponderance in the men than in the women. So it is something to take note of, really. And I think the only thing I can emphasize is that we really need to be cognizant of the fact that COVID is a real disease. It can affect people in different ways, yes, but it can cause death and even long-term morbidity, and men need to take care of their health.
Dr. Morrison-Bligent further explains that there are certain medical conditions that have now predisposed men to COVID-19, which would cause their symptoms to worsen.
I think one obvious one may just be that older men, which we know are more susceptible to the disease, they are more likely to have those underlying chronic, non-communicable diseases that we know puts persons at risk. So your heart disease, your diabetes, your hypertension. And so all of the activities that would have affected men pre-COVID clearly now impact them in the time of COVID. I think the other thing that people worry about, and I don't know if we can prove this because it certainly has not been studied, is if men are less likely to engage in preventative practices. So we speak about social distancing, staying at home, hand washing, wearing masks. It is believed or perceived that perhaps men do this less than women.
The urologist says due to the COVID-19 pandemic, a lot of chronic conditions are being placed on the back burner. For example, men are now doing less screening for certain cancers and other common chronic illnesses which can be deadly.
First of all, screening. We tell people to screen in general, but how can people screen now when we're telling them to stay home as much as possible, right? We know that the priorities in the hospitals are going to change now. The priorities in health centers are going to change. So people will be less likely to go to a health center or even their doctor just for a routine visit now because they are advised to stay home if possible. There is fear just even in going outside. So, and even the activities of many other places, the institutions that offer screening have been curtailed.
Dr. Morrison-Bligent is encouraging men to do their medicals. Of the confirmed COVID-19 cases to date, more than 1,400 or 45% are males. Women make up 55% of the total. With their health report, I'm Shamela Pullen wishing you good health. The Health Report is brought to you